How to find reliable lymphoma research outcomes. When it comes to understanding lymphoma research, especially for non-Hodgkin lymphoma, knowing how to identify trustworthy results is key. Reliable research is based on solid scientific methods, clear criteria, and guidance from reputable medical organizations. First, it's important to recognize that non-Hodgkin lymphoma is a diverse group of blood cancers, mostly involving B cells with many subtypes. Good research clearly states which subtype it studies and uses standardized classification systems to ensure consistency. Next, look for studies that use validated tools to assess treatment response. Imaging techniques like PET scans with fluorodeoxyglucose are essential because they measure how active the cancer is metabolically, giving a more accurate picture than just size measurements. The Deauville 5-point scale, part of the Lugano classification, is widely accepted for interpreting PET scans to determine if the lymphoma is in remission or still active. Other criteria like lyric and RECIL are also used to combine metabolic and anatomical data, especially in clinical trials. Bone marrow biopsies remain important for staging and response evaluation as well. It's also crucial to follow established guidelines from respected organizations. The Lugano classification and the International Working Group provide standardized definitions for response categories such as complete remission, partial response, or disease progression. For lymphomas that take up the tracer in PET scans, this method is preferred, but for those with low or variable FDG uptake, cohort scans may be used. Always interpret response results in the context of the patient's overall health, disease stage, and prognosis. When reviewing research, focus on well-designed clinical trials or large cohort studies. These studies should use clear, validated endpoints like progression-free survival, overall survival, and metabolic response rates. They should also include appropriate follow-up periods to confirm whether the lymphoma has gone into remission or relapsed. Accessing reputable sources such as the National Cancer Institute, the World Health Organization, and peer-reviewed medical journals ensures the information is accurate and trustworthy. Be cautious of studies that promote unverified treatments or lack rigorous methodology. Prognostic tools like the International Prognostic Index help put research outcomes into perspective by considering factors such as age, disease stage, and blood markers. These scores help predict survival chances and relapse risks, giving a fuller picture of what the research means for individual patients. Keep in mind that some emerging research, especially from early trials or new imaging techniques, may still be preliminary. It's important to distinguish between well-established facts and new evidence that needs further confirmation. For patients and advocates, the best approach is to prioritize studies that use PET scans with Deauville scoring, follow international guidelines for staging and response, and are published in trusted medical sources. Engaging with advocacy groups that explain research findings clearly and offer expert interpretation can be very helpful. Remember, lymphoma research is constantly evolving, and medical decisions should always be made in consultation with healthcare professionals who can provide personalized advice based on the latest evidence. In summary, reliable research outcomes come from validated imaging and assessment methods, adherence to international standards, robust study design, and sourcing from reputable medical authorities. This ensures that findings are accurate, meaningful, and useful for guiding patient care.